My name is Anjana, and I am a licensed acupuncturist. I have been in practice since 2009. I love putting needles in people. I just love to see the change that I notice when I insert the needles into the body and I ask the patient to go into a certain position, and you can see that they're seeing the improvement right then and there. And it's wonderful to see the patients feeling pain-free after a long time, and that just makes me happy to see that in a patient's face. My favorite part of treatment is once I've inserted the needles on a patient, and I may ask them to move around a little bit so that we can get the qi circulating, and it is a surprising effect because you see that they are able to move into a position which they might not have been able to before they came in for the treatment, and you can see the glow in their face because finally they are pain-free and happy. First of all, as the patient walks in, we basically get their history, we do a history intake, and we evaluate by looking at their body, looking at the area of the condition where the pain is and so forth, and we start checking, palpating the points where we feel that they need the acupuncture.
I'm Trey Mitsui, and I'm extremely excited for my first acupuncture session.
So, once the patient walks into the treatment room, we will begin by asking them questions related to their health condition, and then followed by palpating the areas of the pain and so forth, and then lastly checking both the tongue and pulses to get a diagnosis of where they are in terms of Chinese medicine.
Now, I don't feel any pain whenever she puts in the needles, which is kind of cool.
And let me know if there's any discomfort with the needles.
Okay.
Are you okay?
I'm fine right now.
Okay, great. And so I'll let you rest for about 20 minutes.
Okay.
And then we'll come back in again.
Okay.
All right?
Thank you.
You're welcome.
So far for my first acupuncture treatment, it's pretty cool because it's something relatively simple in idea, at least for me, and it's making such a drastic difference already, and I've only had the needles in for about 5 minutes now, so it feels really nice to be relieved of what was bothering me.
So now we're basically going back into the treatment room, and I'll be pulling the needles out of my patient, and then from there I will tell him how many more treatments he'll need, and I'm thinking about 5 to 6, and then from there we'll reevaluate him and see where he's at, and either he'll be free to move ahead or he may need a few more sessions. All right, so here we go. Hi Trey, how are you doing?
Feeling better.
Good, very good. So now I'm just going to pull the needles out of you. Were you able to rest?
I was.
So now I'm going to basically pull out the needles from my patient, and we'll have him sit up, and then we'll ask him a few more questions and then move forward from there. Okay. Let's see. Good. Yeah, take your time. And tell me, how are you feeling with the pain?
Feels much better.
Much better?
Mm-hmm.
Okay, great.
Hi. So I just had my first acupuncture treatment, and my legs are feeling substantially better than before I went into the room. I have more range of motion. Now I'm able to weight bear normally and not have to walk so stiff-legged, which is nice. So before my treatment, I had much less range of motion, and it was I was just hobbling around with a straight leg for most of the day so far, so I feel much better.
This is Anjana, And you have seen what you can expect from a typical acupuncture treatment. And that's it for right now from the acupuncturist at Family Chiropractic Center. Thank you.